Hi there, my name is Kelly and I am the co-founder of InterpreMed.com. The reason for me making this video is not just to serve as a sort of common ground knowledge for the InterpreMed Ethics Club for anyone who might be new to our Medical Interpreting Ethics Club or for anyone who might be joining as a guest, just to make sure that we're all on the same page, but also in general for medical interpreters who are interpreting for healthcare facilities within the United States. So I just wanted to do this general overview. To start off with, when it comes to medical interpreting ethics in the United States, we have these three entities that I like to call the big three, which are the main three organizations that have medical interpreting ethics, codes of ethics, and standards of practice. And those organizations are the NCIHC, which is the National Council on Interpreting in Healthcare, and they have their code of ethics for interpreters in healthcare. They also have their standards of practice for interpreters in healthcare as well. Then we have CHIA, which is the California Healthcare Interpreting Association. So within their California standards for healthcare interpreters, they have their ethical principles for healthcare interpreters. And then we have the IMIA, which is the International Medical Interpreters Association, and they have their code of ethics for medical interpreters. So they also have their standards of practice as well. So all three of these organizations have codes of ethics. They have standards of practice for medical and healthcare interpreters who are practicing, I like to stay within the United States, but you can be outside of the United States and still be providing medical interpretation or healthcare interpretation to an organization within the US, and you still need to abide by these codes of ethics and standards of practice. So between these three codes of ethics, there are actually, generally speaking, 9 ethical principles. So these are the ethical principles as outlined. It's kind of like a amalgamation of the 3 codes of ethics. So first off, we have advocacy. And I like to include here that this also oftentimes we refer to this ethical principle within the InterpreMed Ethics Club, which is the club that meets once every 2 weeks, and we discuss medical interpreting ethical scenarios. So this ethical principle, it might encompass the act of advocacy, which the NCIHC outlines that this has 2 requirements. You must be speaking for or on behalf of another party, and you must also be trying to convince someone in a position of power to basically rectify that situation. For instance, and this is the example that the NCIHC gives, a patient has an intravenous port in their left arm. The nurse begins taking their blood pressure on their left arm, and you comment to them, I believe the patient has an intravenous port in their left arm, and we're instructed not to have their blood pressure taken on that arm. So simply providing that information is not advocacy. However, once the nurse starts pumping that blood pressure cuff and the nurse doesn't seem to heed what you just told them, the patient doesn't say anything, but the patient is in danger, their health and well-being is at risk, you are effectively, once you say, stop, the patient is not supposed to have their blood pressure taken on that arm. They have an intravenous port. That would be trying to convince that person to not engage in the act that is inflicting harm upon that patient. So you're doing those 2 things that, according to the NCIHC, constitute advocacy. It's important to note that some medical interpreting codes of ethics and standards of practice in different countries do not include the act of advocacy. So this is something that in some cases is only going to be in the United States medical interpreting codes of ethics. In some cases, not in all cases, depending on what country you're coming from. However, the NCIHC also has their 3 core values, which I haven't listed here. One of those core values is beneficence, which is the health and well-being of the patient. So this is something that is also shared by CHIA, the California Healthcare Interpreting Association. they talk about even when we're considering all these ethical principles, we also need to take into account the health and well-being of the patient. Then, of course, we have confidentiality, which I feel like that one's pretty self-explanatory, but within the context of the U.S. healthcare system, again, even if you are in a different country and you are interpreting within the U.S. healthcare system remotely, you must abide by relevant laws mandating the privacy of patient information, such as HIPAA, which is the Health Insurance Portability and Accountability Act. And under HIPAA, we have the information that we're supposed to keep confidential, which is PHI. So this is my general little summary slide here of what PHI is. You have on the left-hand column, past, present, future medical condition, provision of healthcare, past, present, future payment of healthcare. So that's your health information. And then on the right side, you have your PHI identifiers that tie that healthcare information back to an individual. So you can see all those examples there, like names, social security numbers, as I'm sure you can imagine, can identify a person. But when it comes to medical interpreting ethics within the United States, it's important to recognize that our obligation to confidentiality is not simply limited to HIPAA. We are expected to keep all information confidential. Of course, we do need to engage in an ethical principle we will be discussing later, which is professional development. But, and in the process of engaging in professional development, sometimes we do need to share some things that occur in encounters, but we need to make sure that we are not tying this back to an individual. Then we have impartiality. So impartiality is you are allowed to have thoughts, opinions, beliefs, what have you. However, you are not allowed to allow those beliefs, those biases, those prejudices. It doesn't even necessarily have to be those negative beliefs or those beliefs that we tend to think of as having negative connotations. Just really any personal beliefs of yours should not be interfering with the interpreting encounter. Maintaining boundaries is another ethical principle that is very closely related to impartiality. Maintaining boundaries basically states that we need to stay within the role of the interpreter and not create expectations for the interpreter role that the interpreter role cannot realistically fulfill, such as, well, in in-person interpretation, sometimes I have folks ask me to push patients in wheelchairs. I can't do that. That is not only a liability, but it also violates the ethical principle of maintaining boundaries. Respect is another ethical principle. And this includes autonomy, respecting a patient's autonomy or their ability to make their own decisions about their health. And otherwise, patients are thinking, feeling, breathing adults who are fully capable, in a lot of cases, of making their own decisions. And we need to respect that. We don't need to be doing every single thing possible for the patient, not just because that wouldn't be maintaining boundaries, but also because we are not respecting that patient's autonomy or that patient's ability to do those things for themselves. We also have professionalism. So I believe CHIA kind of rolls professionalism and professional development together, which is fine, but the NCIHC and even the IMIA kind of separate these out a little bit. So professionalism is simply acting in a professional manner, engaging in a professional manner, having integrity, not doing things that would be considered unprofessional. Whereas professional development, which CHIA is considering to be included within professionalism, professional development is constantly seeking to improve your skills to attain the highest level of proficiency in your duties as an interpreter. So this isn't just limited to terminology. It can also include such things as soft skills, like your ability to empathize, your ability to interpret tone, things like that. We also have accuracy. So this is kind of the cornerstone of interpreting, really. We need to interpret everything accurately and completely. NCIHC calls this ethical principle accuracy. However, the California Healthcare Interpreting Association refers to this as accuracy and completeness. I like that. So like I said, these 9 ethical principles are kind of a mishmash, whatever you want to call it, of all of the big 3s, codes of ethics for medical interpreters. Then lastly, we have cultural awareness. I often refer to this as cultural responsiveness. I like that one better, actually. However, cultural awareness is the terminology that the NCIHC uses. CHIA uses cultural responsiveness. I like cultural responsiveness because it implies that we need to go further beyond just being aware of different cultures, but also being able to effectively respond to those differences and sort of serve as a bridge when it comes to those cultural misunderstandings. So these are our ethical principles for medical interpreters, and these are based on the 3 main U.S. medical interpreting codes of ethics, as well as their standards of practice. So their codes of ethics explain, okay, well, what are the values that are important to interpreters, whereas those standards of practice kind of reflect like, okay, how are we going to honor these ethical principles? And then I also like to kind of go over the CHIA ethical decision-making process. So CHIA, the California Healthcare Interpreting Association, has their ethical decision-making process that determines, okay, well, if we have an ethical dilemma in the field, if we have a situation in which multiple ethical principles are in conflict in a particular situation and we're having difficulty making a decision about how to navigate the situation, what do we do? So this is something unique that CHIA has to offer us, is this ethical decision-making process. So first I'm going to show CHIA's full ethical decision-making process, and then I'm going to give you my kind of short, sweet, and to the point version. So the first step in the ethical decision-making process by CHIA is to ask questions to determine if there's a problem. Sometimes in this first step, well, there might not be a problem, right? We might just ask this question and discover, well, there really isn't a problem here. The second step in the California Healthcare Interpreting Association's ethical decision-making process is actually a 2-step step. So remember, step 2 is 2 steps, 2. The first step of step 2, the first part of step 2, is to identify and clearly state what that problem is. And then you need to consider the ethical principles that may apply to that situation and rank them in applicability. So first, you're going to identify and clearly state the problem, then you're going to rank those ethical principles that we just showed you in order of how they apply to that particular scenario. Step 3 is to clarify personal values as they relate to the problem. This is where that ethical principle of impartiality really comes into play. You need to take an honest accounting of, well, how do I feel about the situation? What are my kind of gut instincts in the situation? Are they valid or not? Step 4, consider alternative actions, including benefits and risks. So you're going to think of different possible ways that you could respond to that situation. And then ideally, because you've created that sort of ranking of ethical principles in terms of applicability, you want to make sure that you are considering your risks and benefits in terms of those ethical principles. Step 5, you're going to choose an action and you're going to carry it out. You're going to do the thing. Step 6, well, you're going to evaluate the outcome and consider what might be done differently next time. So because you can see those consequences of that scenario in the real world, you want to evaluate those consequences. You want to evaluate the positives from that situation. You want to look at it from all angles and consider, well, what could I have done differently in responding to the situation? But also you might want to think about, well, what could I have done differently to prevent this situation from happening? Now, this is all fine and good. It's a little bit long for me, so I really like to do this. Make it a little bit more simple. So the first step is, do we have a problem? Step 1, is there a problem? Step 2, you want to identify the problem. You want to rank those ethical principles. Step 3, personal values, read the problem. So personal values relating to the problem. Step 4, you're going to take your actions, list out your actions, and then for each action, you're going to list the pros and the cons, the benefits and the risks. And then, geez, I hope I don't get dinged for this, but okay. Obviously, this is the Nike logo. I do not claim ownership to it. However, listen, brand recognition, do the thing. Just do it. And then step 6 is to evaluate the outcome. So again, this is kind of base knowledge. This is knowledge that we are essentially going to assume that folks coming to the Ethics Club meetings have already. And then in addition, sometimes we have international members who participate in our meetings, and just getting an idea of, okay, this is the framework that we are working in. So you're welcome to bring in your own ethical principles. However, we are going to try our very, very best to stick to these 9 ethical principles that these 3 codes of ethics have in common based on these U.S. medical interpreting ethical standards. And they are issued by these 3 organizations, the NCIHC, CHIA, and IMIA. So, if you are not yet an InterpreMed member, feel free to join us at InterpreMed.com. We get really, really deep into medical interpreting ethics, which I think is really important. It's helped me as a practicing medical interpreter, as an in-person interpreter. And I know for a fact that it has helped my colleague Nanji, who is a over the phone, video remote simultaneous interpreter based in the Dominican Republic. I am based in Richmond, Virginia. So yeah, if you are currently an InterpreMed member and you are not actively participating in our Ethics Club meetings, they're open to all InterpreMed members, and they'll be posted to the calendar on the InterpreMed website for all logged in members. So please feel free to comment if you have any questions, and hey, we might discuss them in an upcoming Ethics Club meeting, or we might post a follow-up video about this information that was contained in this video, or we might even create some practice materials on InterpreMed based on your questions. So definitely stay engaged, and we'll see you soon. Bye-bye.